Welcome to People's Health Panel News. This is the 6th edition of People's Health Panel News. Each edition is sent out every month to highlight what we're currently working on. Remember, if you have friends or family members who would like to join the People's Health Panel, we would love to hear from them. Please direct them to our email address at the bottom of this newsletter. Best wishes, the People's Health Panel team. Join us at our annual general meeting. You are invited to join us at our annual general meeting on Wednesday the 6th of July 2016 from 6 to 8:30 p.m. at Birmingham Botanical Gardens, Westbourne Road, Birmingham, West Midlands, B15 3TR. You can take advantage of our free access to the Botanical Gardens as well as free parking from 6 p.m. You'll be able to hear about our successes and plans for the future as well as look around our health fair with over 20 stalls from organisations like the British Red Cross, Birmingham LGBT and Health Watch Birmingham. You can register for our annual general meeting by clicking on the link in the newsletter. People's Health Panel in action. Last month, over 80 people, including healthcare professionals, local organisations and People's Health Panel members, attended our first Health and Diversity in Birmingham event. Our event was held as part of the NHS Equality, Diversity and Human Rights Week. This event was held on the 6th of May at the Bawdsley Centre in Borsall Heath, and attendees were invited to explore equality, diversity and human rights issues for the NHS in Birmingham. Birmingham is one of the most diverse cities in the UK. The purpose of the event was to raise awareness of different communities' healthcare experiences to help us to ensure that we continue to meet the needs of local people. We were delighted to have local and national speakers to talk about their different experiences of health. Our speakers were Paul Hopkins, Queen Alexandra College, Birmingham, with My Story of Having a Visual Impairment. Alison Byrne, Specialist Midwife for Female Genital Mutilation Service, Heart of England Foundation Trust, with a presentation FGM. Asif Afridi, who is the Deputy CEO of BRAP, presentation on Race, Equality and Health, Challenges and Opportunities. Adrian Jones, Policy Officer, National Federation of Gypsy Liaison Groups. The theme, Improving Health Outcomes for Gypsy, Roma and Traveller Communities. Peter Rooks, Third Sector Liaison Officer for the Birmingham Council of Faith, Faith and Health, The Connections. Following each presentation, discussions were held on each table. A number of different topics were discussed, however, two in particular stood out. What are CCGs doing to tackle the issues of FGM, female genital mutilation, from a Commissioner's perspective? What more can be done to raise awareness of the needs of transgender people? Following the event, the safeguarding teams from local Birmingham CCGs have met to discuss how commissioners can support the NHS to tackle the health issues associated with FGM. Furthermore, Birmingham Cross City CCG will be holding education events for its member GPs to raise awareness of the health inequalities suffered by transgender people and women who have health issues associated with FGM. We would like to thank all of our presenters, staff, attendees, all who helped make our Health and Diversity in Birmingham event a success. 3 new blogs as part of Mental Health Awareness Week. Last month we told you about our brand new blog area on our website. Our latest blogs come from a mental health nurse, a doctor and a local patient. The theme of this year's Mental Health Awareness Week is relationships. read through the thought-provoking blogs by clicking on the link in the newsletter. If you would like to do a blog about something you have experienced in terms of health conditions or healthcare, please email us and we will be happy to discuss with you. Students winning design. We recently teamed up with the School of Visual Communication within the Facility of Arts, Design and Media at Birmingham City University. Adam Oliver, a third-year student at BCU, fought off stiff competition to design the winning mural on the walls of the CCG's headquarters on Hagley Road, Edgbaston. The artwork, the image is available in the newsletter, which depicts iconic Birmingham landmarks such as the Library, Rotunda, Grand Central and the Cube, have been produced in a reportage style by the illustrator and design student who is originally from Leicester. Speaking about his work, Adam said, "I was delighted to be chosen to work with the NHS. It's been such a fantastic opportunity to produce something on a bigger scale. I've had some help along the way from fellow students and I'm really pleased with how the final product looks." Paul Sheriff, Director of Operations and Corporate Development at CCG, added, "It's been great to be working with Birmingham City University on this project. It's a really unique piece of intricate art which has been produced by an extremely gifted artist. It is a real talking point with both staff and visitors. It depicts Birmingham brilliantly and reminds us all what a great city we serve." 2 opportunities for you to give us your views on local NHS issues. The first survey is about NHS Continuing Healthcare (CHC) pricing and purchasing options. CHC is the name given to the package of care which is arranged and funded solely by the NHS for individuals outside of hospital who have a health need at the time of discharge. For more information, click on the link in the newsletter. The closing date for this survey is the 3rd of June 2016. The second survey is about the NHS Healthcare Travel Cost Scheme, HTCS. The HTCS was set up to provide financial assistance to people who use NHS services, do not have a medical need for ambulance transport, but who require assistance with their travel costs. For more information, please see the link in our newsletter, and this closes on the 3rd of June 2016. If you have any questions about either of the surveys, please don't hesitate to get in touch. How can we improve support for carers? The Department of Health wants to learn more about the lives of those who give their time and energy to support friends or family members needing care. They would like to hear from carers, those who have someone care for them, businesses, social workers, NHS staff and other professionals that support carers. The information received will help deliver a new strategy which sets out what carers need, one that reflects their lives and the health and financial concerns they have about themselves, their families and those they care for. Please send your views by 30th of June 2016. The National Association for Patient Participation, NAPP, will hold its annual conference on the 11th of June 2016 in Stretton, Cheshire. The theme of this event is Transforming Services Together, Transformation, Integration and Federation. What do they mean for patients? To register, please click on the link in the newsletter or email NHS England. Your Care Connected. Your Care Connected is a new system that will enable doctors, nurses and other healthcare professionals working in hospitals to view information from a patient's GP record, with the patient's permission, to provide better, safer care. The system will be rolled out over the course of 2016, becoming available to all of the hospitals across Birmingham, Sandwell and Solihull, including the Queen Elizabeth Hospital, City Hospital and Heartlands Hospital. It will also be made available to Birmingham and Solihull Mental Health NHS Foundation Trusts. West Midlands ambulance services, out-of-hours GP services and every GP practice, meaning that up to 1.8 million registered patients across the area will benefit. To find out more information, see the link in the newsletter. Applications sought from people with lived experience of personal health budget. Applications are being sought from people with lived experience of personalised approaches to health and social care to participate in a personal development programme. The programme is being delivered by People Hub in collaboration with NHS England. Applicants must be willing to commit to playing an ongoing role in shaping policy and practice within integrated personal commissioning and personal health budgets at a national and local level. However, levels of commitment may vary depending on people's individual circumstances. The deadline for applicants is 9 AM Monday the 6th of June 2016. If you'd like more information about the programme, please send an email to. Also on this month, the 12th to the 18th of June 2016, Diabetes UK, Diabetes Week. 13th to the 19th of June, Men's Health Week 2016. 14th of June, the World Health Organisation's World Blood Donor Day. Get involved on social media. If you use social media sites like Facebook or Twitter, we'd love you to follow us. Thank you.